Hi everybody, thanks for joining us. Dr. Ben Shamoil here, the LA chiropractor right here in Century City. We're here with one of our patients. She's into her third phase of care. Yeah, your third, yes, strengthening almost there. Third phase of care. Now in our office we do 3 phases. And before we used to do just adjustments, and the adjustments were fantastic. But what I noticed was the patient was not holding their adjustment for long periods of time, so we had to include some strengthening. This due to bad posture or being behind the computer, or now everybody's on their phones. So in our phase 3, we work very closely with strengthening and improving posture. So today we're just going to go over a quick adjustment right now. Came in with initially with cervical pain, cervical discomfort, a lot of tension and stress going on in here. So our first focus was to make sure that subluxations are all cleared out. One of the things that we do in here, we do biofeedback. Now, everybody's noticed that somebody who's had a stroke has had stress on one side of the body. So we know that there's a backup system, right? They've had a stroke in the brain and it's literally shut down one half, either the left or the right side. Well, we utilize biofeedback to see where there's stress on the spinal cord itself. So when we are checking our patients, we can see that there is a discrepancy in height right there. Okay, now we ask the patient, can you turn your head to the left for me? And again, nothing going on there. To the right for me. I could feel some changes there, and you might notice that it improved, but it's not 100%. Back to the middle, because most of the stress is coming in the low back. So when we're either checking the cervical spine down here or checking the low back from here, we could see exactly what's going on and make that correction. Okay, so today we're going to be doing the low back first. We're going to take the tension away from that low back. Want to improve. You can see all the nerve flows right in here. This affects the reproductive organs, the bowels. It affects all the nerves going down into the leg, pins and needles, knee issues, hip issues. So we always want to make sure that the foundation, the floor, looks good. And then we work our way up the spine to making sure that the atlas up here looks good. So you can see the areas that are dense, and that's how we get your health back. So I'm going to go through a quick adjustment, making sure. I'm going to get out my magic blocks. There we go, magic blocks. Let's have you lift up this side here. This side here. Now as we do that, we're going to come back up here. See that the balanced out right there. So that twist in the hip is corrected by those blocks. There we go. Evened out. So that's most of her stress is happening in the low back. We use a pneumatic table. That's what that noise is in the background. It's actually an air pump, and allows us to get into that pelvis. So I'm right in here, right in her pelvis. Nice deep breath in for me. Dropping that right in. I'm going to come to this side of the sacrum. Right side for her. Nice. Wow. Palpate, see exactly where. Okay, right on that. Lower lumbars, L1, L4, L5. There it is. Just want to post check that. Want to make sure it did my work. There it is. Remember, legs were totally uneven when we first started. Back without the blocks. There it is, nice and even. And then we're gonna restore this by strengthening this area so she holds her adjustment, doesn't have to be in the doctor's office continuously, doesn't have to have more problems years down the line, okay? So this is gonna help blow out that subluxation in the low back, get her back on her feet, having her live a healthy lifestyle. If you'd like more information, give us a call, thelachiropractor.com. You can book online. We'd love to take care of you. Have an awesome day.
Woo-hoo.